My name is Dr. Hirak Sen. I'm the Director of Cardiac Arrhythmia Service at West Florida Hospital. I became a physician because I wanted to help people. I grew up around a lot of poverty, a lot of deprivation, and I developed a sense of compassion for humanity from a very early age. And then I've lived in several continents, and I have continued to serve the best I could, the sick and the poor. Cardiology is where my interest in engineering meets care of the patient, and it is the number one killer, and heart disease usually ends in a bad arrhythmia, and that's where I come in. I'm an expert in arrhythmias. Yes, my dad was an electrical engineer, and I had a liking for engineering and physics from a very early age, and I followed the development of science as it applies to cardiac arrhythmias for many years, and then I realized that that would be my chosen field to work in. I specialize in cardiac arrhythmias, which means the rhythm is not right. The heart can go too slow or too fast, or it could be irregular. Not all of this is necessarily dangerous or life-threatening, but some of this is. And I specialize in the diagnosis and management of arrhythmias of all stripes. The most rewarding part is when the patient gets better and they come to see me in follow-up, and they give me a hug or a thank you or send me a card saying that it was all so wonderful, that they feel so much better. I enjoy the acquiring new knowledge and applying it to my patients and see them get better. That is the part that gives me most joy and comfort. I like to cook. I like to eat all kinds of international cuisine, and my wife is from China, and we spend a lot of time in restaurants, and we try to cook ourselves those things in our own home. And then we like to travel, and I like to go to the beach and also hike in the mountains. When I was in Albuquerque, I did a lot of hiking in the mountains. Now I hang around the beach quite a bit, every chance I get. Sure. I want people to know in Pensacola and the surrounding communities that we provide expert care in all kinds of arrhythmias. We do pacemaker implantation, pacemaker follow-up, defibrillator implantation, ablation of complex arrhythmias, and I see patients in consultation as inpatient and outpatient too. Out here in West Florida Hospital, we have a very collegial environment, and we help each other out in every way we can. It starts from the hospitalist or the ER physician that calls us to do a consultation, and from then on we collaborate with our partners in other specialties and provide the best outcome for the patient. In cardiology, we have interventional cardiologists, general cardiologists, and electrophysiologists, such as myself, and we collaborate in every way possible for the best outcome of the patient.